Hi, today I'm going to be talking about cholecystitis. Cholecystitis is a disease of the gallbladder, which is a small pear-shaped organ located under the liver, and its job is to store and release bile. Gallstones are made up of cholesterol or bile pigment, and these small stones, or sometimes large stones, can obstruct the flow of bile in the cystic or common bile ducts. So cholecystitis is an inflammation of the gallbladder, which can be acute or chronic. Acute cholecystitis is caused by these gallstones blocking the common bile duct, and it is associated with right upper flank pain, fever, and leukocytosis. Chronic cholecystitis is thought to be related to chronic inflammatory cell infiltration of the gallbladder, which can be caused by either mechanical irritation or recurrent attacks of acute cholecystitis. So inflammation occurs in the gallbladder, which initiates a release of inflammatory mediators, which then worsens the inflammation. Acute cholecystitis, as I mentioned, is caused by an obstruction of the cystic duct from gallstones. And when these stones block the bile flow, patients will suffer from biliary colic, which is a term used to describe the pain that they feel from the severe spasming of the gallbladder muscle as it attempts to move these stones along. Acalculous cholecystitis is a less common form of cholecystitis, and it does not involve gallstones. It affects about 10% of patients suffering from this problem, and it is associated with higher morbidity and mortality rates. It's typically seen in patients that are already hospitalized or critically ill. These patients will have gallbladder inflammation that's caused by gallbladder stasis and ischemia. The gallbladder ischemia and stasis, as well as endothelial injury, can cause a concentration of bile salts, which then can cause gallbladder distension and eventually necrosis of the gallbladder tissue. The most common complication of cholecystitis is gangrenous cholecystitis, and this can happen in up to 20% of cases, and it is considered life-threatening. These patients will present with the typical symptoms of cholecystitis, so the abdominal pain, fever, leukocytosis, but also have more severe symptoms and signs of sepsis as the inflammation response becomes more systemic. They might suffer from tachycardia, hypotension, an elevated lactic acid level. Risk factors involved with cholecystitis. So women tend to develop more gallstones than men, and people who have obesity or high cholesterol diets will develop more gallstones. Women who have given birth to several children are also at higher risk. Risk factors to develop the acalculous cholecystitis, so these patients that aren't developing gallstones, include patients, like I mentioned, who are hospitalized, suffering from infections, diabetes, AIDS, any immunosuppression puts them at higher risk to develop the acalculous cholecystitis. Major signs and symptoms include, like I mentioned, fever, leukocytosis, and that's caused from the inflammation of the gallbladder. Right upper quadrant pain, because that's where the organ is located, and this pain may radiate to the shoulder and back. Patients can also complain of nausea. They may vomit and have anorexia, decreased appetite due to the buildup of the bile that's unable to be processed due to the obstruction from the gallstones. And here's a picture of the small organ underneath the liver and what the gallstones look like that are sitting there blocking the flow of bile. Diagnostic testing, patients can have ultrasounds, and that will show gallbladder wall thickening from the inflammation. Patients will also show a positive sonographic Murphy sign, and that's when the ultrasound technician is palpating the gallbladder with the ultrasound transducer, and upon the pressure that's felt from the transducer, the patient will report feeling pain. Ultrasound can also identify gallstones within the gallbladder. Treatment for this condition is typically surgical. A laparoscopic cholecystectomy is the most common treatment. Patients that are at high risk or are not surgical candidates can be treated with IV antibiotics and perhaps have gallbladder drainage procedures. And that's my discussion on cholecystitis. I hope you learned a couple of new things today. Thank you.